Ah, it shows that the broadcast is live. Well, hello, everyone. Good morning from the West Coast. Good afternoon from the East Coast. And hello, if anybody is listening from somewhere else. We are The Squeeze. This is Lori and Lucille. I am Lori. If you don't know who we are, this is Lucille. And this is Dr. Forbush, and we are continuing a conversation that we had on our last episode, episode 8. This is episode 9. We talked last time about the DCP model, or the direct care, primary care model, with Dr. Forbush, and we got an overview of everything. Well, Dr. Forbush is actually the founder of Osteopathic Center for Family Medicine in Hamden, Maine. He is also the president of the New England Primary Care Alliance. He utilizes this direct primary care model, and he has a lot more behind his name, but if he wants to share that, he can. But that is the primary synopsis of who he is and why we had him on here, because it's very interesting. We had a very interesting conversation last time, and we want to continue getting into the nitty-gritty this time.
So we thought that to begin this conversation, we would replay a very small snippet from our last discussion with Dr. Forbush. So let me try to do that. This is the first time I've shared a screen, so bear with me.
Go, Lucille.
I know.
You got this.
Issue. This is about providing high quality, cost effective healthcare to people. That's what it's about. Whether you want Medicare for all or you want a completely free market system, it doesn't matter. This works. This is an apolitical issue.
Oh, I'm so glad you're saying that, because this show is not about politics. It's about people.
Right.
So did that work? Did you?
We could hear it. We didn't see it. We heard it.
Oh, well, hearing it is good too. I did. I can do it one more time, but I think hearing it is also effective.
Yes, I think we're good.
Yeah. Okay, great. I know. I see what I did wrong too, so that's a good thing.
Always learning. That's why we're doing this. You know,
right.
we are not polished. We are not perfect. We're going to be perfectly imperfect and still do it.
Yes, correct. So it's not about politics. It really is about helping people, and so they get the best medical care possible. So what I wondered, Dr. Forbush, is if you could kind of explain for us whether or how does insurance, we think that insurance protects us,
Right.
and helps us to get the best medical care.
Right.
And at the best, it protects us financially. So what's your take on that?
So I'm going to start out by quoting a good colleague of mine, Dr. Jeffrey Gold, who he practices in Marblehead, Mass, and he loves using the term "we have an addiction to insurance," meaning that we specifically in regard to health insurance or medical insurance, but we have this false sense of belief that, number one, we need insurance to receive medical care, and number two, I pay money for the medical insurance, so therefore I should have everything that I need, or everything under the sun should be covered. And it's hard. I understand that when patients or employees or whoever, when they get a 63-page manual for their health insurance policy, to understand what's covered and what's not covered. The truth of it is that more times than not, it contributes to excessive spending in healthcare and for services. So, for example, actually, I'll share another example in a moment, but hospitals, laboratories, physicians' offices, doctors that work for the insurance companies, I should say, have a negotiated rate of what Anthem or Harvard Pilgrim or Cigna or whoever, they have a rate that they know they'll get paid by that insurance company. Now, on the outpatient side, it's often not enough to cover the cost of providing the service, which is why a lot of folks in private practice, not in direct primary care, but those that are working for insurance companies, well, they have to see 30 or 40 people a day. They're like used car salesmen. They got to get people in and get people out to break even. Now, having said that, there are other situations, like for example, with laboratory testing or imaging or whatever, where the contracted rate is not the same across the insurance companies, and it's very different than what the self-pay rate could potentially be.
Mm-hmm.
So in situations like that, having insurance could actually hurt you. So let me give a more specific example. One of us needs to have, I don't know, an MRI. We'll just pick that as an example.
Mm-hmm.
So an MRI is a covered service on whoever on my insurance plan. Let's use myself as an example. And the MRI facility has a contracted rate for what they're going to get reimbursed from my insurance company for that MRI.
Mm-hmm.
And then I have a contract with them that says I have to pay a certain amount out of my pocket as a deductible, or a certain percentage of that as part of the benefit plan that I have. So let's say that the contracted rate is, I don't know, $3,000 or $2,000 or whatever. And let's say that my deductible or the portion that I'm responsible for is I don't know, 20% of that. Okay, so 3,000 times 20%, what's that? $600, give or take. If I do my math right, someone checking my math. So,
I want to trust you.
But if I were to then walk in and say, listen, I don't have insurance, I want to pay cash for this,
Mm-hmm.
then the facility may say to me, oh, you know what? We'll offer the cash price of $500. So using my insurance in that situation just costs me an extra $100
Mm-hmm. Mm-hmm.
on top of my monthly premium that I'm spending the entire time. So whether it's an MRI or even I can get a chest X-ray for a patient locally for about $49 cash. If they run that through the insurance, they're probably going to pay $100. Well, that doesn't make any sense.
No.
Why is it that if I'm using a service that I'm paying for, that I then have to pay more?
Yeah, it doesn't make any. It really is crazy. And I just read an article that about right now the insurance companies, the CEOs are getting just incredible amounts of money,
Right.
and their profits are skyrocketing. So we have to ask ourselves, why is that?
Between 1970 and 2009. So the data is now, a little over 10 years old, because data has to be collected and studied and before it's actually published.
Mm-hmm.
But between 1970 and 2009, there was a 2,300% increase in the growth of healthcare administrators.
Yeah.
I think it was in that article too, Lucille, that you shared. Oh my gosh.
And we're not talking 2%. We're not talking 3%.
Yeah.
We're not talking 200%. We're talking 2,300%.
Yeah.
So when folks say, what's the fastest growing healthcare profession? Healthcare administrator.
Yeah.
And you can make billions and billions and billions of dollars.
Yeah, apparently that's exactly what it's looking like, but it's hurting us as patients.
Oh yeah.
Because we're ending up, actually, we think that we have, I have really, really good, I'm lucky, my husband's company, there's good insurance, but I'm actually probably paying so much more for everything. And that's money I could put towards better care, perhaps in like a direct primary care setting, as what you offer, Jack.
Right.
And did you already, can you just give us another, kind of a quick of what direct primary care takes insurance out of the picture?
Right. Since people who may not have seen the last episode.
Yeah, right.
Okay, so Walmart and your local grocery store have these super saver medication lists. Okay, so I'll pick on Walmart for an example because I think there's a Walmart in every corner of the United States now, or something crazy like that. So let's say they have they'll sell a month's worth of a very common blood pressure medication called lisinopril, $4 a month. It sounds like it's the best deal since sliced bread and home delivered oil. It's only $48 a year. We'll call it 50 just for easy math. $50 a year for my blood pressure medication. Well, what the patients don't know, and what many doctors don't know, is that an entire year of that same medication at a wholesale price is probably, I don't know, $6 or $7. So what Walmart, essentially what Walmart is charging 1 month for, I can get an entire year for an extra couple of bucks. Now,
so wait a minute before you finish, because the clarity here for me is that they've been charging us so much for so long that when you tell us this savings, we're like, oh yeah, we feel like we're saving. Then you tell us it's even crazier. I mean,
well, it's like the clothing store that, 3 weeks before their big sale, they mark everything up 20%.
Yeah.
And then they say, 25% off today. I mean, you're right. It's this game.
Smoke and mirrors.
Yeah, it's all smoke and mirrors. And it's the hard thing is that although this information is accessible, a lot of folks, including a lot of doctors, don't know that it's accessible.
Yeah.
I talk to doctors all the time and they say, how is it that you order your medication? And I say, I called up and set up an account. Well, you can do that? Of course I can. Why can't I? Why can't I choose to pay someone's lab test for a discounted rate and then just get reimbursed by the patient? Why not?
And that's why we're having you on here, because we don't know. We do not know. I didn't know. Lucille didn't know. Who else doesn't know?
Well, it's I blame my profession to a certain degree, physicians, in that we almost willingly gave up the authority and the power several years ago because we wanted to take care of patients. We're not, by nature, we didn't go to business school to become a doctor. We went to medical school to become a doctor. And when more and more and more of the administration of healthcare has been taken away from doctors, the fungus has grown. And these are some great examples. I mean, this is why, in this article, you got United Healthcare Group CEO David, I'm not sure how to pronounce his last name, Weichman. His total compensation is $18.1 million.
I know, it blows my mind.
$1 million.
It blows my mind.
It blows my mind.
I was trying to find the article because I want to make sure I'm getting the numbers correct, but I couldn't find it. But since the introduction of the Affordable Care Act, at least in Maine, the premium rates have gone up double digits every year. So we're not talking my premiums went up 5%. No, we're talking 20%, 15%.
Right.
So what's up with that? I thought the Affordable Care Act was supposed to make things affordable.
Yeah, I'm very confused about that.
I think it was, it's really too bad because we had an excellent opportunity to fix a lot of things wrong in healthcare. And for whatever reason, whether it's tort reform, for example, whether it's medication pricing, or whether it's, there are a lot of things that we could have done right with the Affordable Care Act. And I think that the folks who wrote this and whatever, they just kind of lost their way a bit. And certainly the third party insurance companies have benefited from it. That's not my opinion. That's just their numbers. That's why you got this United Healthcare guy making $18+ million a year. Right.
You're just stating facts. There's no opinion here. I mean, the numbers tell the story.
Right, exactly.
Yeah.
So it's really too bad that we wanted healthcare fix and we didn't get it. We didn't get it. I mean, we got some semblance of it. We've got some subsidies for folks for their on the exchange, but we didn't fix a whole lot of other things. We took, insulin, which was supposed to be essentially a public health free product, now costs $600 a month.
Yeah, that is
What? Why?
right.
And I'm as much of a free market kind of business guy as there comes, but when there's no restraint on this, and I'm not saying government needs to step in. I think people need to be empowered. That's kind of the message I was trying
People need
to convey last time.
empowered. Yeah.
So doctors, patients, we need to be empowered to know how we can make things better.
I totally agree. So I went in for my, I went to see my gynecologist, and he says, you're going through menopause. This was a couple years ago. And he gave me a prescription for, I think, 2 medications. I had a friend who had already started taking these 2 medications. He suggested them, and I said, well, I trust my friend. I, of course, trust my doctor. So I went to go get those medications filled. And the cost, I don't even recall, because, the memory has gone, probably because it was so exorbitant.
Yeah.
It was, I think it was close to $200, if not more, to fill 2 prescriptions for a month. And I'm like, I'm just going to sweat this thing out, literally, figuratively.
Yeah.
And then I went back and told him I did not take the medication, and I told him why. And he's like, that's crazy. So he gave me a workaround as well. But, I'm starting to seek, more answers to this. And so this conversation is so needed.
So give us some examples. Now, Laura, you could forego that medicine, but there are some people who can't.
Right.
Because their medical conditions won't allow them to, and therefore they have to pay the exorbitant cost.
Right, I'm going to go into debt to save my life.
Right,
Yeah.
exactly. So, Jack, give us some examples of the different. I know you already gave us a few examples of like what, if you're going through with insurance, you pay this much, but if you're going through direct care and the doctor, for X-ray or for medicine, this is what they're paying. So
I'll give you this. You're probably going to laugh your pants off with this. So,
really?
Yeah.
Or cry?
I'll cry. No, this is about a year, maybe 2 years ago.
Mm-hmm.
I have a lady over the age of 65 who's on Medicare. So I'm going to use a Medicare example.
Mm-hmm.
Who needed a cane that she uses for walking.
Right.
Okay? Now, a cane is a covered service as a durable medical piece of equipment.
Right.
Under Medicare. They require you to fill out a form. You send the form gets sent off to a company that sells durable medical equipment, and there has to be some kind of medical justification. So in this particular situation, the cane was going to cost like $200. Okay, so they needed a lot of medical justification. Like, does this person really need a cane? So I got a little fed up. I went on Amazon.com and got the same darn cane for $10 and delivered it with a bow on it. Said, here's the cane.
So infuriating.
So, it's so when folks, and so it's examples like that when folks say the pro Medicare for all folks, I don't think they're aware of situations like that where that's unsustainable across the entire population. That's $190 difference on one cane.
Mm-hmm.
So if we take the entire population over the age of 65 and say only 25% of them need a cane, that's a lot of money. So that's why I think that whether you're conservative or liberal, Democrat, Republican, doesn't matter. We all want this. We all want people to get high quality, cost effective care. And unfortunately, that's an example of how that mantra of Medicare for all really needs to be qualified. Like, what exactly are you referring to? Because if you're referring to what we currently have as Medicare, there are some things that need to get fixed in that. And this is a great example, a $10 cane costing $200.
Right.
There's, that's, or the Lisinopril that costs $7 a year. Why does it cost $4 with my insurance card or whatever?
Right. $4 a month, right?
Right, $4 a month versus
$4 a month compared to $7 a year.
Exactly.
So what you can provide.
Right.
with the direct care, primary care model. I think it's interesting too. I was reading that 80%. So of course, if something really serious happens to you, you need surgery. There has to be insurance to cover those costs because they're huge. We're talking about primary care.
Right. It's not catastrophic care.
Right.
It's primary care.
Right. But it's interesting to me. I was watching Dr. Savage's video on the New England Direct Primary Care Alliance website. And he talks about that 80% of medical care can be done in a primary care office.
Oh, easily, if not more.
Wow.
Yeah, at least 80%, if not 90 or even 95%.
Wow. So at the most, we probably need coverage for 20% of our medical costs.
Exactly.
So we're paying huge amounts for our insurance.
Correct.
For primary care, that
Correct.
if we took the insurance companies out of it, would cost us pennies on the dollar.
Exactly, pennies on the dollar. So I've long advocated, I've long said, part of the healthcare solution is to have insurance, is to take primary care out of as a covered service on your insurance, because it can be done so much more efficiently and so much more cost effectively. Stop.
Cool.
Don't let fill in the blank third party. They don't pay for primary care. And so my example, my practice or Chad's practice, Dr. Savage's practice, great examples of how we can do this so much less expensively.
That's interesting, because he talked about the fact that the primary care model costs the same as maybe a gym membership.
Exactly.
I would do that in a second for preventative care.
Right. So
Seems common sense to me.
And a lot of
how do we get it done? How do we do it?
Well, we do this. This is what we do. I mean, we get the word out there. We pull the rug back and sweep the dust bunnies out. And we, so if you look so my practice, I do minor surgery in the office. My colleague Vance Lassie out in Holton, Kansas, he does the same thing. So there's an enormous amount of your routine stuff, and even a lot of your urgent things can completely be taken care of in a primary care office, completely.
And you spend more time with your patients.
Yeah. And so
you get to know them.
And the ripple down effect is it helps to keep emergency rooms decompressed so that they're there when somebody comes in and half their guts hanging out, or they get a bone sticking through their. So
right.
We talk a lot about how important primary care is, but on a large level, we've not really made changes that are consistent with our stated belief of how important primary care is.
And another thing I want to read. So another thing I found fascinating in Dr. Savage's presentation, and maybe you can speak to this as well. And Lori, you have a question about this. But he said, if you can just decrease healthcare costs, it impacts both businesses who are paying for healthcare for their employees and our country, because you can pay more in wages than putting the money towards healthcare, and the economy will boom. So I think, Laura, you had a question related to that.
I muted you because I have the trash truck going by right now, but I'm not quiet right now. But anyways, yeah, because I work with a lot of small businesses. And what I find is the small businesses care about their employees. I mean, that's part of why they're doing what they're doing. They want to take good care of their employees. And part of that is giving them the opportunity to have a health insurance. But health insurance kills small business. I would love to I want to start talking to a couple of my small business owners and see if we can get them on. We have the doctor's perspective. So thank you, Dr. Forbush. Lucille and I are giving some, patient perspective, but this is so complicated there's so many aspects of this that need to be addressed, and we need to talk about it to get to a better solution.
Mhm.
And so the cost savings for a small business is not just the dollars spent on the actual insurance policies per se, but as every small business owner knows, it's also lost time out of work.
Absolutely.
You know, so that's a big impact, particularly for the small businesses. I mean, if you've got a dozen employees, for example, and you've lost one for the day, that's a big impact. So if you've got a great example, I've got a guy that runs a general contracting business.
Mhm.
He's got maybe 4 or 5 employees, and had a work site injury, and he called me up and said, "Can you stitch the guy's hand back up?" Sure, not a problem. So his out-of-pocket cost went from an emergency room visit, okay, down to the direct primary care membership, and the whole thing was done in 45 minutes.
Oh, God, I'm loving this.
So, and the other thing too is the follow-up is with the same person.
Right.
So,
Right.
Come back in a couple of days. Let's take a look at this hand again. Okay. Oh, you need some antibiotics. I've got them right here. I think the antibiotics cost $2. So you just took what was probably a $1,500 ER visit and you dropped it by 95% or something crazy like that.
Right, because you're not charging them for the $10 Band-Aid and
right. That's the membership model. So yeah.
Do you have other businesses, Dr. Forbush, that are involved in your direct primary?
And they see it. The answer is yes. And when I talk to the owners, they see it as an employee benefit, but not necessarily as a medical benefit. If that makes any kind of weird sense, they want to have healthy and well employees, and the cost effectiveness of a membership gives them as employers a great deal of reassurance that if I've got an employee that's sick, I know they're going to get taken care of. So and taken care of on the same day. So there's a lot of that kind of intangible. I just want to be a good employer and I want to treat my employees properly, kind of perspective. And that goes both ways. The employees say, you know what? My boss really cares about me.
it seems like the primary care model is putting care back into
right. Yeah.
the people's
That's
preventative medicine.
Yeah, that's kind of what we went to medical school for.
Right.
Yeah. I mean, the current, it allows you to be a doctor, right?
Yeah, exactly.
It allows you to be a doctor and care for your patients. It's very frustrating when you have an illness with the current insurance model because everything has to be approved, right? For us and for you too, I believe, as a doctor.
Yep.
You're sent to all these other doctors. It's so easy to miss things.
What happens? With the fragmentation of care,
right?
Things get fragmented.
Yeah.
So even despite everyone's best intentions,
right?
Okay. When you start putting more pieces into the puzzle, or you got more cogs in the engine, you got more problems that can develop, and things they fall through the cracks.
Yeah.
So here's a great example of a recent patient. She and her husband joined maybe 3 months ago. Terrible knee pain. Went to see her, her organized medicine, crime lord doctor. Okay.
No there.
Had an X-ray which said you got terrible arthritis. Okay, you need to see an orthopedic surgeon. Okay, goes to the orthopedic surgeon's office. For whatever reason, the X-ray didn't make it, so she gets another X-ray. It says, "Oh, you have terrible arthritis. We need to set you up to a cortisone shot or probably a knee replacement, but we need to have you get that referred from your primary care provider." And I hate that term provider, but that's a whole other discussion. So she goes back to her family physician, who now doesn't have the x-ray from the orthopedics office. She's seen by one of the partners who orders another x-ray. So now we got 3 x-rays.
Oh God.
Showing the very same thing. Okay. You've got terrible knees. You need to have it replaced. We'll have to get your MRI authorized, because we've got the x-ray. You got to get it authorized. You got to do this. You got to do that. You got to do that. And this is 3 months later. I go to my office and say, "Can you help me out?" I see them. You've got the x-rays. Call up the orthopedic surgeon's office. She's getting her knee replaced in 2 weeks.
Wow.
So, it's when you add a lot of those stuff into the equation of patient and physician, things get very complicated. It's like algebra.
Yeah, and I mean, I have experience with many of my friends, misdiagnoses.
Mm-hmm.
They miss simple things because I think there's such a rush.
Right.
And, and it causes you to do so many, cartwheels.
Yeah.
And you're running all over the place, and it's a simple thing, and I think it's very frustrating.
Well, the other thing that comes to mind with the simplicity of things, like sometimes, I know myself. I'm over 50. I know the things that my body has gone through.
Right.
And you just want to call your doctor and say, "Hey, I've got this thing going on. You've known me for 30 years. Can I just get a prescription for this?" But with our current model, we can't do that because they can't charge me for that phone call.
Right.
So what I saw in the video that I dropped into the comments is that he talks about the fact that using tech to connect is supported in this, whereas the current model we're in doesn't support it all, because you mentioned it earlier. They don't know how to charge for that.
Right. There's in the insurance-based model, there is no incentive to do offline or remote management. There's none. They talk about wanting to involve virtual health and telehealth and things, but functionally, there's no incentive. On a direct primary care model, my incentive is to help you get healthy and keep you healthy.
Right.
Okay, and
the way it should be.
Right. So, whether it's a texting service or email or video service. So here's how this comes back. Here's an example how this impacts the small business. So one of you are at work and you're like, I just don't feel good. I got a rash or something. You pull up your phone, you text me, or you do a video chat with me. You don't leave work.
Right.
I got a question about X, Y, and Z. If I say, yeah, you ought to come down to the office, that's an easy answer. Or, oh, no. That you had this 6 months ago. We know how to handle it. We can take care of it fine. So there's a convenience factor for the patient, for the physician. It's more efficient. It's more effective. It's great for the small business too, because they don't have to worry about someone being gone.
It also supports where we're going in the future. We are so tech oriented.
Right.
Mm-hmm.
This would support any kind of platform that increases our technology and our connection that doesn't include coming into an office. It supports that. And
So in the insurance-based model, let's say you're diagnosed with diabetes. You need to come back in a month so we can review your blood sugar numbers. Okay, come back in a month. There's another copay. There's another bill submitted to the insurance company. Okay, we need to make this X, Y, and Z tweak. Come back in a month. We'll run the numbers again. There's another copay. There's another office visit submitted to the insurance company, et cetera, et cetera, et cetera, to do nothing but review numbers. What I say is keep track of your numbers, email or text them to me. I'll respond back what we need to do.
Right.
So the cost of the greater healthcare system for that is nothing.
So we're taking the middleman out.
Right. Yeah.
We're taking the middleman out of primary care.
Yeah.
The simple things.
Yeah.
This is a quote that really struck me when I was watching the Docs for Primary Care. They had a convention in November.
Yep.
and a Dr. Ellen McKnight,
Yes,
who, you know, is a real advocate.
she's a powerhouse. Honestly, she's a powerful person.
Yeah. So anyway, this is what she said, and I thought it was really interesting. She said, you know, we think that we have like great insurance, Cadillac, you know, level insurance, you know. And I've said that about my father-in-law, who's 93. He has awesome, awesome insurance. And this is what she said. Huge amount of money. So you're paying a huge amount of money only to be denied services when needed. The Cadillac turned out to be a money guzzling junker for most Americans, and patients not being protected as claimed from financial ruin. So, you know, insurance is supposed to protect us from financial ruin, but instead it's causing the system to be inflated and,
Right.
You know.
Well, it's feeding into itself too. I mean, it's self-perpetuating.
And she also referred to the medical administrative state,
Yeah.
which I found fascinating, which she includes hospital administrators, health IT, IT executives,
Yeah.
Health insurance CEOs and CMS bureaucrats.
It's like a medical axis of evil.
That's kind of scary, that terminology, the medical administrative state, but it is really a matter of, how do we get more knowledge out there? How do we get this out there more? I know this helps.
Sure.
This helps, but what can the doctors do? What are the it looks like there is a coalition of doctors, and you have your Health Alliance, you have the Primary Care Alliance, and you're trying to affect legislation.
Mm-hmm. So, so we have our regional, but there's also a national group of which I'm a board member. I think it comes down to a couple simple things, seemingly simple things. Number one, doctors need to be empowered to a certain degree to understand that they do not have to be a slave to the system.
Yeah.
They don't have to be. And I emphasize that because a lot of doctors, they don't think that they have any other option.
Right.
And and understandably, we're compassionate people. That's why we're doctors.
Yeah.
And well, what's going to happen with my patients if I decide to do this? Well, frankly, your patients will decide whether or not you're worth it. That's what they're going to decide.
Yeah.
But the cost is the cost savings to the soul is greater than the continuity of slavery. So being aware that they can do it, seeing practices, not necessarily like mine, but like mine, that show that this is a viable financial model. It's viable for as an income for the physicians. It's great for patients because it's relatively inexpensive in the greater scheme of things. It allows them to be the doctors that they want it to be. So that part of it is raising the awareness to let them know that yes, this is real. It can be done. If I can do it, anybody can do it. Okay. So, and then, I think that's the biggest thing is physicians need to understand you don't have to work for the medical axis of evil.
So not only do doctors need to be empowered and talk about it, but patients need to be empowered and talk about it and put some money behind. I mean, social media is a great way to get that word out. Right.
It's true. Because as you said, Jack, I think it's true. Doctors don't know they have a choice. Patients don't know that they have a choice.
Well, I think so. The other part of what I was going to mention, I just thought of now, is a lot of doctors don't know how much things cost. Like they have no idea what's the average price for a fill-in-the-blank test.
Yeah.
You know what the other problem is? Not only that doctors don't know what the cost is, because I had these conversations when we talked in the other show about my dermatologist. not only do doctors not know the cost, but they don't know how insurance works with them, right?
Right.
Because I'm sitting here telling him, well, I got charged this and I got charged that. And he's like, that's crazy.
Exactly.
He had no idea until I spoke up.
Yeah. I mean, we went to medical school to be doctors, and what seemed like a very reasonable thing to begin with, i.e., someone else takes care of the business side of stuff, has just overgrown like a bad case of toenail fungus. It's just become unsightly and disgusting, and we gotta pull a toenail off, I guess. Physicians need to be empowered. Patients need to be empowered. Patients need to understand that they do not have to accept anything less than excellent healthcare. And if they're not getting it, if I don't like a restaurant, I'm going to go to a different restaurant. And patients need to be empowered to know, if I don't like what I'm getting here, I can go somewhere else. Physicians need to understand, I don't like this, I can do something else.
Yeah.
So it's really about, I used the phrase blow up the system last thing, and I was kind of tongue in cheek, but it really is about, it's empowerment. It's empowerment for choice.
Right.
Yes.
And it's information that people need. And like you said, Lori, I mean, social media is the way, right?
Right.
You know, we're both, Lori and I, are digital marketers. We're online marketers. And I'd certainly like to see your organizations using more,
Right.
Of these tools.
Right.
Get the word out. So people.
If I knew I had a choice, I would make that decision. I didn't even know I had this choice before.
And so that's part of the struggle is so our alliance is run by all volunteer physicians.
Right.
So we're all seeing, and not to say that we don't have the time, but you understand, I mean, as marketers, you understand that there is time involved in putting things like
everything.
This. Yeah. So we're whether it's the regional group or the national group, we're all volunteers.
Right.
And so our ability to have something really consistent, it can be a challenge, but we are trying to get the word out, at least locally and nationally, on social media. The national group has put together over 100 articles for direct primary, for physicians that want to get into direct primary care. So all the educational material is being built for these for the docs that want to escape.
Yeah, which is great. And I really did find the YouTube channel Docs for Patient Care fascinating.
Yeah, they do a great job. They do a great job
on that. And then again, the New England Direct Care Alliance.org. So
NEDPCA.org.
That also the information on that is fabulous too. So yeah, Lori, I think you put up Dr. Savage's
YouTube. Yeah.
That's
I think we can wrap this up. I mean, I think we could go on and on. I think we've brought up some great points that, I mean, Lucille and I can share this information. I mean, we appreciate your time so much, Dr. Forbush.
Thanks for having me on.
Yeah.
I mean, you have really helped to enlighten us. And and we're going to continue to share the message.
Great.
And we have a YouTube channel now too, so we'll get that up and it's very frustrating. It's very frustrating. And the other thing I just wanted to mention is, before we get off, is I guess there's a lot of books out there, Jack, that are written by doctors about this issue. One that was mentioned this morning when I was watching the YouTube channel, Doctors for Patient Care, was Broken Doctors, Broken Systems by Eric Levy. And I understand there is a doctor in Boston who has written about 4 books. And let me see if I can get his name right. Or even find it. But, oh, here it is right here. Atul Gawanda.
Oh, Atul Gawande. Yeah, he's another very powerful, very powerful speaker. Atul Gawande. If anyone on the physician side of stuff, Doug Farrago, Farrago, has written a couple of great books for physicians looking at getting into this. And for small business lawyer, I'm in the midst of renovating my office, so I can't find the book that I'm going to send you a link to.
Okay, great.
But it's about a small business that saved somewhere in the Midwest, saved literally millions of dollars on their healthcare by changing their catastrophic, wrapping that with a membership, doing some independent contracting, and saves a ton of money.
That would be where I want to go.
I'll find it somewhere. My office is blowing up at the moment.
Yep. All right. Well, we're going to let you go. Yeah, do send us that link so that we can share it. Because I'm sure businesses would be interested in.
Oh, yeah.
And as Dr. Forbush had mentioned last time, we want you to vote. This is where sharing all this information on the squeeze in order to just give you more information about what's going on out there in your world in America. I'm tired of being squeezed. I think we're all tired of being squeezed. So vote, and vote locally, as he mentioned the last episode.
Yeah. And we'll see you on February 13th. I think that's our next show.
Yeah.
Thanks a lot, ladies. I really appreciate your time.
Thank you. Thank you, Dr. Forbush. We appreciate it. Take care.
Bye-bye.
Bye.
I should have put it on my phone. What you were standing there.